Alphonse ji, please start.
Sudhi and Amit and everyone, Prabhat Das, everybody, it's a wonderful meeting you here. We just, I'm coming from the Parliament. Parliament didn't work today. Yesterday, we had a very unfortunate day in the Parliament, a really black day when the opposition almost attacked the chairman and they jumped on his table, danced there, they tore up the rule books, they banged the constitution, they tore the papers through all over the place. And why? Because we said, let's have a vote on the bill, on the two agricultural bills which came up. And they said, no, they wouldn't. They wouldn't want to vote because they didn't have the numbers. See, in a democracy, all that matters really ultimately is we give a voice to everybody. Even if there is just one person out in the parliament, that person is given the right to speak and he speaks. But finally, when it comes to voting, I think they should allow the parliament procedure to go on. And they did not. They pulled out the mic, destroyed the chairman's table. I think it's extremely unfortunate. Today, some of those people were suspended from the House till the remaining session of the Parliament. And of course, they wouldn't leave the Parliament and therefore the Parliament couldn't proceed. So very unfortunate. I don't really know why we can't stick to rules, why these rules which have such sanctity, it's just not being complied with. You know, I'm at a pain. I've been an MLA in Kerala. Of course, I was an IAS officer before that. I've been in Parliament now for 3-4 years. I just wouldn't move from my seat at all. I mean, whatever I want to say, I'll say in my speeches. I mean, we all have an opportunity to speak. And then to go do this to the House, we represent people. I think there's a sense of responsibility. Anyway, coming to the subject today, I think we are going through extremely difficult times. And we do not know where it is going to end. For the next 1 year should be to be alive. To be alive is a miracle. I think that's one thing which everybody should take care of. I don't even really think business should talk about expansion, dreams. I think they should just learn to survive. If they learn to survive, I think it's fine. The same with NGOs, with social organizations, which have been hugely dependent on CSR, money being contributed by the public. I think, next 2 years is going to see an end to all this. Basically because most of the companies have not been working for the past 6 months and there will be no profits this year. And therefore, the statutory CSR contribution which they are supposed to make is not going to happen because the money is not there. Then I think most of the public sector undertakings, they have contributed generously to the Prime Minister's PM Care Fund, and therefore many of the public sector undertakings also would not be able to contribute largely to the CSR funds. I mean, these are very difficult times. A lot of people in this country, a lot of NGOs, and NGOs, they don't exist for themselves. They are doing so much of good things. I mean, looking after the people who don't have a voice, the voiceless people, feeding them, educating them, giving them dignity. I think now is the time for all of us. Forget about the corporates. Forget about the government PSUs. I think forget about the big corporations. I think this is a time for each of us to say, what can I do? What can I do myself? Forget about it, the government. Government is doing plenty. Government is feeding 80 crore people for 6 months. I mean, we have come out with a 20 lakh package, COVID stimulus package. So government is doing more than what it can. Now let us each of us. So let me tell you what I'm doing. You see, we formed a WhatsApp group here called Distress Management Collective. We are a group of about 300 people, just ordinary people. Let me tell you, during the past 6 months, we have fed 1 million meals we have provided. 1 million meals. And you see the background. I mean, you possibly saw the background of where I was sitting. My mother, my mother had COVID, and of course, she was in AIMS. She got cured, but then because of the after effects of COVID, she passed away. We started this scheme called Mother's Meal. I mean, it's just not about my mother; it's about every mother. You know what's our objective? On the 15th of August, on the Independence Day, we started a feeding program wherever the government cannot reach. That's our objective. Government is doing plenty, but we need to supplement. In 36 states and union territories, we supplied food kits to people. And this year, our objective is to reach again 1 million meals. We will reach it. We are walking to the forest, reaching to tribal areas, going to places where people are absolutely starving, where the government is not being able to reach. We are reaching out to people. So these are things which are possible sitting at home with a mobile phone. Let me also tell you, if you don't mind, please don't think I'm talking out of a pride or a sense of I want to broadcast something which I'm doing, but I think this is possible. In my quarters in Two Lodi Estate, I have about 12 families staying here. None of them have a job. None of them have a job. I'm getting about 12 food kits from grocers online. We buy everything online. I buy one extra for myself and my wife, and the rest 11 kits goes to the people who live there. Same, absolutely same food. They are also given milk and eggs. They eat the same food. My wife bought for them clothes from Amazon, the same clothes which my wife is wearing for all these people, not only for these 11 families. There are about 40 people there, children, then their in-laws, their sisters, their brothers back in the villages. We sent about 40 checks. The other day, my son came from London and he bought about 40 shoes for all the people staying here and also the other employees who are staying outside only. So I'm stopping here. I'm not doing anything great. I have to ensure that people who depend on me, they don't starve. I have to ensure that children who depend on me are able to go to school. They get their milk. And also, these people who are dependent on me, the relatives, if anybody needs an operation, it's my job to look after those things. I'm not a rich man. So whatever I get from the parliament as an MP, whatever I'm getting as IAS pension, all this money and much more goes to these people. Am I a great person? Not at all. I think these are the small little things we can do, which all of us can do. And therefore, I think in the CSR times, I think let's change our focus a little bit, because the big money is not going to come in. But let each one, like in the US, I've said this earlier, in spite of US being what it is, 40% of people contribute to charity. In India, less than 2% of. Can't we take our charity a little more? Me, my family, my temple, my church, my mosque, only they get the money. I'm sorry. It's time. This COVID times, we don't know whether we're going to be alive tomorrow. Please be generous. You know, Sudhi, the blue jacket I wear today, that is from my Masuri days, 41 years. Why do I need a second blue blazer? Why do I need? I have one pair of shoes. I use it for 7 years. Why do I need a second one, Sudhi? I'm just asking people, please, let's take care of people. I think that's all my appeal. Thank you very much.
Thank you. That's a lovely thought, actually.
My humble thing is, please don't think I'm boasting. Because I feel deeply that if we in this country, each of us really care for one more family, then just the little people around us, I think the problem is over. That's what I sincerely believe.
Yes. Actually, we just need to extend ourselves a little bit. But you've done a wonderful job by feeding so many people. And even Save the Children's reach has been 6.5 lakhs per month. But apart from food, there have been many other necessities which my association with the disability sector and with the children's sector, child sector has shown. You know, that this mental health has become such a big issue for children who are locked down, and think of those who are intellectually difficult. How do you explain to them why they can't go out of the house? So that is another thing which the NGOs and people have taken up in a big way, to help parents, to help children on how to deal with these lockdown problems. And this is proving to be a big one. Another thing where this COVID has affected, especially the girls. The school used to be a safe place for them. Now what is happening is that with this economic distress, a lot of girls are being married off because to save on expenses, and then you hive off your expenses and put them onto another family. Kind of abuse stories that have come out of domestic abuse, child abuse, it is frightening, that families, when they have to stay together, can't stay together because of all kinds of reasons. It has, in a way, this lockdown has been good. It has inspired people to go do good for others, but it has also brought out some very basic facts about families in India, about which we need to tackle. And Alphonse, you being in the parliament, you're in such a good position to bring it to the notice of the policymakers that we need to do something about dysfunctional families, in India, because they are our, the basic unit. Because a child which is subjected to abuse carries it till his grave, and it is all, it will destroy us in the end, because all these dysfunctional children. I was reading a report on child marriages, about teenage pregnancies, rather, about girls who left homes because they were abused in the house. They left homes with unsuitable people, became pregnant, are in shelter homes. They don't know what to do. And what will happen to these youngsters less than 18? These children born out of such marriages. So the welfare aspect or development aspect, I would say, about families, we need to get into this sector. Government, of course, is doing a lot, but the qualitative thing also needs to be looked into. क्वांटिटेटिव तो ठीक है, खाना मिल रहा है, बहुत लोग खाना दे रहे हैं, and it is, really a lot of people have come out to give food. I know of very small NGOs, individuals. There is this girl, Tina Sharma. She has distributed sanitary napkins to girls during the COVID because nobody thought of it. Then there is this another small NGO, which has funding only from, as you said, from people like your WhatsApp group. They have given food, they have given masks, and to quite a substantial number of people for about 90 days when the lockdown was there. Then this hospital, SAVE, has done a lot of work for the street children to look after them. It is their mandate, but even then they went out, risking their health in the process. Then this hospital, Subharti, which I am associated with, they upgraded the services. They treated about 1,500 people, all from their own funding. Nobody got funding from anybody. Somehow the CSR funding went into a lot of activities, but it didn't really trickle down to the ground level, the grassroots level, as they say. But this COVID has brought out something good, and that is that people have become conscious. They are also responsible for society, and they must make an effort to do something. It motivated Tina Sharma, who's a Navy officer's wife. It motivated this Navratan Foundation people, who are just a group of people in Noida. It motivated the doctors in Subharti Hospital. It motivated the SAFE people. There's so many, and then it motivated all the NGOs associated with the intellectually disabled to hold these webinars. Almost every day they're doing something to help children who are affected with mental illness. And so in a way, it has brought the country together. I mean, everybody is now understanding the problem of another person. Earlier, you would sort of ignore any helper coming into your house. But today, you make sure that person has food, that person is looked after. It has taken a lot of time. It's somebody else, say Mr. Garg, who can share his ideas on this topic. Ashish ji.
Thank you, ma'am. Thank you so much. Respected Alphonse ji, ma'am, Amit ji, and all the members present here. Thank you so much for providing this opportunity. As far as the Institute of Company Secretaries is concerned, during this pandemic, there are 3-4 initiatives which I would like to highlight before all the esteemed panelists. One thing that we have done during this pandemic about the PM Cares Fund. Everyone is aware the purpose of PM Cares, the purpose why Prime Minister has appealed to all the nation to come out and give the generosity through this PM Cares Fund. So,
hello, Ashish.
Ashish.
Yes, sir.
Ashish, where is the money going to come from? People like Sudhi who are doing so much of work and so many people dependent on your companies. Are you going to give us the money this year or not? I mean, very clear, simple, straight question.
He has
Don't give us
got,
theories.
sir. He has got 65,000 company secretaries with him. 65,000
I
company
know, so
secretaries.
he knows it. So are you going to give us money this year? Because as I'm told, you are going to say, sorry, this year we didn't work, 6 months was lockdown, and rest of 6 months we are not going to make any money, and therefore the CSR rules won't apply. It's very easy to tell us rules. We don't want rules, man. As Sudhi was saying, we have millions of children out there who are starving. I slightly disagree with Sudhi though. She said now people have become more generous. Actually, it's not the case. Earlier, all old age homes, orphanages, they all had, food coming from marriages, birthday parties every day. Now, during the past 6 months, because it doesn't exist, marriages and birthdays don't happen. Problem is that the food is not coming in, the money is not coming, nothing is coming to these old age homes at all. Like we run one in my village, and every day we used to have 365 days. Today, nobody is coming anywhere that way with any food or anything. So, Ashish, you will you give money to us?
As a statutory body, you are aware, I am representing the Institute of Company Secretaries. I am not representing the India INC, because I am not representing the corporates and I am not representing the. So I am representing the institute, which is a statutory body passed under the Act of the Parliament, coming under the Ministry of Corporate Affairs. So we are having a 60,000 members and 3 lakh students. So from our corpus, we have given this amount to the PM Cares Fund for the benefit of the institution. As far as our members are concerned, where our members are working, so one thing which I would like to tell you, that our members who are working in the companies, who are working as a practicing company secretaries, they at their own are doing so much of work during this pandemic on a regular basis. Even I am from Indore, and when this migration has happened, so many members and so many people of my society, my company secretaries went there on the bypass roads and the places where all those migrant workers were going. And we have given them all the foods and water packets and medicines with the grace of God. Nothing we have done it great, but we have collected the society together, and it's a work from all the society which all have done together. So as far as institute is concerned, we are doing it separately, but as far as members are concerned who are working in the company, they are doing at their own bit. And the members who are practicing and in an individual capacity, they are doing the CSR on regular basis.
I don't know, Ashish, whether you remember the Prime Minister's address to your institution and to the Institute of Chartered Accountants saying you are the conscience keepers of the corporate sector. I'm asking you in that capacity. You are the guys who keep accounts. You are the guys who advise the management on the best utilization of money. You are not just auditing, okay?
Prime Minister has come in 2 different institutes. One you are talking is about Chartered Accountant Institute,
I know.
The Company Secretary Institute. So as far as accounts and auditing is concerned, with due respect, that is the duty of the Chartered Accountants. But as far as governance is concerned, as far as compliance management system is concerned, where the company secretaries plays a role. So at that point, company secretaries are playing it very aptly.
Okay, so we would like to see the money coming from the companies where your people are working. Okay, it's simple.
Yeah, okay. Because we are following the rule of CSR in a letter and spirit. The rules have been other than CSR has come 4 years, 5 years back. But India INC and the corporates were doing the charity since years. When the rule of CSR was not there. So if the rule has come for the 2%, and today if India INC is not having a profit, it is not justified. I'm not representing them. I'm not arguing on behalf of them. But it is their call to make the corpus in the CSR.
You are right. Absolutely.
Yes, sir.
Sir, just one last question. You were instrumental in handling the Kerala tragedy, the Kerala floods tragedy, probably the face of the government, and not probably, certainly the face of the government, who handled the crisis at the ground level for months. And this is a pandemic which is probably of a different nature than, but the devastation caused is probably much more at a national level. So how do you think we can draw from certain of your experiences for the COVID pandemic handling in the coming 6 months?
See, Amit, handling a flood, states today have the expertise. Take, for example, the Orissa government. They have the best expertise in handling floods and how to handle it. I mean, even if, we today the Met warning is very good. So, from the warning, how many people have to be evacuated for how many days, how far away. All this is today known. So, states have the expertise, and therefore, it's not too difficult to handle floods. Though Kerala was underwater completely for the past 2 years, it's caused such huge devastation. But yes, but the state came to see what was so fantastic about this is the light in which I was talking to Ashish. The entire state of Kerala came together to feed people, to clean up houses. 400,000 houses were underwater, under 2 feet of silt. This group of young people made groups of people. They went around cleaning these houses, getting them clean, which was the most difficult thing. So it is just not the government, it is not the law, it's a conscience of people and saying, yes, Vasudeva Kudumangam, we are one, and therefore let's do it. Now, the problem with the pandemic is the floods lasted a month, maybe a month and a half, but the pandemic has been here for now 6 months. We don't really know how far it's going to go. I just reading an interview by Bill Gates saying possibly by 2022 we may have a vaccine and therefore get back to some shape. I mean, I shudder to hate. I mean, to think what is going to happen. I mean, for me to be speaking to you now is a miracle because my mother had contracted COVID, and of course she got cured, but then she died within a week because of the after effects of COVID. So to be alive itself is a miracle. So what's going to happen? And we have millions of people who have lost their jobs. When are they going to get their jobs back? When are the children going to study now with this distance education, online education? How is a poor guy who can't even afford one meal a day, where is he going to get a digital equipment? How? So as it is, there is a huge digital divide of the rich getting all the benefits of education, and today the poor are going to be left behind hugely. So these are some of the issues which worry me hugely, and I don't really know what the solutions are. Well, my organization, my WhatsApp group also has been providing computers and also smartphones. But how many can we provide? We need millions of them, millions. So the enormity of the problem, we don't even know. And I wonder why some people are even trying to predict in 2022 your GDP growth would be 7%. I think we just, getting into exercises which are completely useless because we don't really know where the COVID is going to take us. It's wrecked the global economy, wrecked us. Where is it going to take us? We have no idea at all.
Actually, to my mind, if I come in, we need to look at COVID as a medical problem. We have to find out facts about the disease, how to handle it. First, in proper management of the disease, and second would be getting into the economy and think very clearly about it, because India being so much scared, it is difficult to think of things like the lockdown. Nobody even thought that the migrants will go from wherever they were to walk to the next, which was never in detail. But a medical crisis became a humanitarian crisis. Medical continued and this continued further. So all of us need to sit together. We need to think it out on what to be done, because now it appears that this COVID thing will be there for at least next 2 years or something. It's not. It's a virus which mutates so fast. Is something that we all don't know, but we have to put all the facts together, and this has to be done at a global level. You can't see. Somebody says yes and somebody says no, and half facts are there. And first, the medical crisis, and then the things which are pertinent to it, the fallout of this medical crisis. What do we do about different sectors of society? How do we tackle it? What are we going to do about it? How do we ensure food for our people? At one time, it was being said that people recover from COVID, but they may not recover from the starvation. There may be mass deaths. But I think, and that spurred individuals into action. And they said, "नहीं, खाना तो खाना ही है." And yes, people work that to the country, but as Mr. Garg said, sadak sadak risk their lives. My own friend, he was there morning, evening. Seva Bharti, I think through Seva Bharti, they provided food and water to the people trudging down the roads. But I wish it could have been done in the same way like uh, it is the Kavadiyas. Somebody and the Kavadiya procession passes Noida. It is so well organized that if we had done that for our migrants, it would have shown them India, everybody cares about them. And the pity of it is when they went to their homes, even homes did not welcome them. And they were quarantined, they felt stigmatized, so many problems. But in some cases, like my servant was telling me in Hardoi, he belongs to me, that the Gram Pradhan was good. Whatever funding he got from government, he gave it to the migrants who were coming back in, and they were well fed and well looked after. But I don't think that has happened everywhere because there were a lot of complaints about whatever government had sent that was not well utilized. But at least this was one hope story where he said कि his Gram Pradhan took things in hand. So in a way, this COVID has raised a lot of issues. As I said, some good, some bad. And the good thing is that people realize that the have-nots have to be looked after. We cannot leave them at the mercy of mercy of God, in a way, under the open sky. On the other hand, what was happening inside homes, domestic abuse, child abuse, the quantum jumps in it that was really, really sad, because that is something we need to tackle. Since I have worked with children, there are studies to show that domestic violence, if a child witnesses domestic violence, it is intergenerational. It goes from, he will do it with his own family, and the whole thing will go on forever. And domestic violence का जो effect होता है is mental health gets affected. So we need to make families safer. This is one takeaway that we must take from this COVID, that we need to work much more on these issues. Food तो अपनी जगह है. If a person is in good mental health, they can always earn money to buy food, or food is the easiest, I would say, now to give. It is in the Indian psyche कि मुझे तो अन्नदान करना ही करना है. But as an NGO friend who stays next door, she says, खाने के लिए तो बहुत पैसा दे देते हैं लोग, लेकिन when it comes to domestic violence, nobody is willing to come forward to stop it. And the effects of domestic violence and abuse are much more than, say missing a meal for a day. And this is where I think we need to get more into these issues, so that our society is safer for people.
Okay, can we request Ashish Garg ji to kindly throw some light on the different contribution and CSR initiatives?
Yeah, maybe one thing which I've told about the initiative as far as PM Cares Fund is concerned, and ICSI being a statutory body has organized. But one of the initiatives which I'd like to tell, which Amit has also asked me to throw a light on that, is the Shaheed Ki Beti certificate. One initiative which we have taken, it's a voluntary initiative, rather giving the faculties and the guests as a memento and the flower bouquet. We are giving one certificate of a particular value of that bouquet and memento. And the amount which we generate over the period of years from this memento and bouquet, we are contributing it to the Shaheed Ki Beti Certificate Fund. It is basically a fund which is created for the martyr's daughter. So specifically education fund for martyr's daughter. Till now we have donated around 20-30 lakh rupees. Last time we have donated 5 lakh rupees to Rajnath Singh ji. And again soon we are going to donate it another 5 lakh rupees to the defense minister or the appropriate ministry. So this is the one initiative which we have done it through this CSR, can be called as a CSR initiative.
I believe there are going to be changes in the CSR rules about what can be counted for CSR. Because
it is an exhaustive rule given in the Companies Act and the schedule. It is already an exhaustive list, and some of the funds like PM Cares was not there in the schedule, which was incorporated during this amendment, which was proposed just 2 days back in Lok Sabha and the Rajya Sabha. So it was already notified by way of circular, but some of the things related to vaccination for COVID and PM Cares, which will be included officially in the list of CSR.
Because initially CSR was very, very cut and dried, and now I think with the COVID coming in, it's been made more flexible. So that will be a good idea, because then that will encourage companies to be more innovative, Otherwise, they were spending money. Actually, I was in this Department of Public Enterprises when CSR guidelines were brought in. And that time, as you rightly said, a lot of companies were doing a lot of charity work. There was no coalition of it. It was not being collected in one place. Now it is that thing has started. And by making it compulsory, it will encourage companies to do some more thinking, because we have to extend ourselves, It should not be left to the initiative of the top boss, whether he thinks about others or he doesn't. But now he will be forced to think, and the more we think about others, then you will find that there are more and more places where you can work with people. Like I'm on this company which makes lubricants. So I said, have you ever thought of mechanics to work for you? In the automobile sector. They said no. I said, please work with these chotus, as they are called, because they are the ones, they are your frontline people, and this was before. They will need your help, because if we can help them, you help yourselves and you help your person who is product into the into the marketing stream. You're a very poor person, not had the opportunity of formal education, but who is equally talented. I mean, if we can give them some kind of training or something, we can increase their productivity. They are inhaling fumes which would be affecting their health. These fumes may be also addictive fumes. As they say in drug, when drug substance abuse happens, then it is that solution which they say is one thing that a person cannot get out of. Every other drug you can, rehab a user, but not that. Remember that white transparent fluid we used to use as a whitener? It is called solution, probably a branch of solution. But that is one thing the doctor said, if any child gets addicted to that, we can never do any kind of de-addiction work with that child. And that's a permanent damage happening. So there are many such areas where we can get into as thinking people. Probably it never came to our minds.
Ma'am, we have been joined by Dr. Alexander Thomas.
Yes.
Now, since this is about COVID and COVID warriors, Dr. Thomas represents as the president of the All India Private Healthcare Association owners of all healthcare providers. So he is the president of that. So they know this is a horse's mouth as to what basically this COVID thing is all about. how the healthcare industry has coped with it till now, what are the challenges, and even we have Mr. Ashish Garg, the president of the company secretaries, and Dr. Thomas, very welcome to you. Namaste. And we are there. Mr. Alphonse just left before you joined,
Okay.
and we are there with Mr. Ashish Garg, who is the president of Company Secretaries Institute, and Ms. Tuti Kakkar. She is the former chairperson NCPCR and also the secretary to the Government of India Disability Department. So, sir, now we would also like to hear from you about what are the challenges faced by the healthcare industry and what is the way forward.
Yeah, thank you, sir. It's a pleasure to be here. Thank you for your invitation. I'm sorry I couldn't join earlier. Now, I'm actually the president of the Association of Healthcare Providers. It's not the owners, healthcare providers. So we have hospitals, mainly the smaller hospitals, some of the many mid-sized hospitals, and a few large chains, and also other providers and other organizations. So let me start off by saying that in the private healthcare has contributed greatly. If you go pre-COVID, I think in the board committee initially had said that there should be an increase in the government hospitals, and it should be in the ratio of 30 private and 70 government. Unfortunately, that has not happened. The private sector is now almost 70% of the healthcare sector. In fact, in the tertiary care area, it's almost 90%. This is not a healthy situation. And AHPI has been lobbying with the government saying you have to increase the number of government beds. And there are institutions of excellence in the government, like NIMHANS, you have All India Institute, you have Kidwai. And the government hospitals should be made accountable and transparent. And one of the things that we found and that we have lobbied with is that most of the government hospitals have about 80% vacancy in specialists. So it's like having a bus full of passengers without a driver. Fortunately for us, we've been in dialogue with the government, and that situation is being remedied. The last path-breaking decision by the government was to start diploma courses in the National Board of Examinations. So coming back to pre-COVID, private players were providing 70% of the treatment. They bought in the latest technology. They bought in the latest state-of-the-art medicines. In fact, I'm always reminded this public-private partnership is so very important. A few years ago, and this is how it should be, universal health coverage. A couple of years ago, Dr. Devi Shetty and me were going to Belgaum. And on the way, we stopped for breakfast at a small darshini. So while we were having breakfast, a middle-aged lady came and told Devi, "Sir, thank you for saving my son. He's doing very well." So we were wondering, how did this happen? So to cut a long story short, this lady who was below poverty line had a child who had a heart deficit, was operated by Devi through a public-private partnership where the government paid for the fees. And an example of getting the best care in NHS, probably one of the best centers in the world, the best surgeon, Devi Shetty, and a person who is below poverty line who got this without spending a naipasa. So I think it's very important in the present context that we have to, the public-private partnership is very crucial. Now coming to COVID times, unfortunately or fortunately, initially the government did not include the private healthcare facilities, but when it came to be known that they wouldn't be able to manage alone, it is now all over the country. It is now the private care health providers who are providing most of the care. Unfortunately, if you look all over the states, we have our state chapter meetings every fortnight. Unfortunately, the public wants to go to the government hospital, to the private hospitals. And a lot of government facilities are remaining half empty while the private sector is absolutely chock-a-block. Now, coming to a very important aspect, I think this private-public partnership is fine. Pre-COVID, all the private hospitals were part of the Prime Minister's health scheme because they felt it their CSR, corporate social responsibility. The reimbursements by the government are just about 30% of the actual cost. There are two government studies which have shown this. One that we did in the government of Karnataka showed that the percentage that is being reimbursed is only 30%. So it's okay when it's a small percentage of 5 to 10% of poor patients. I think it is fair that the government expects the private health sector to extend subsidized treatment. But if we are to make universal health coverage something that is going to benefit our patients and something which is going to go down into the at the grassroots, something which will prevent millions of families going into the below poverty line because of catastrophic spending. That is, they have to spend money for health and therefore they go below the poverty line. If we are to do that, then I think there has to be a proper understanding between the government and the private players. Because now with Ayushman Bharat, more than 40% of the patient load is going to be under this scheme. And to make it work, I think you have to also make it affordable. HPI's, if you can say, tagline is affordable quality healthcare for the common man. And if we are to make this a reality in the present circumstance, I think it is important that the government talks with the private health sector, because if the private sector is going to continue to give subsidized rates for the poor and more than 50-60% of their population, the private healthcare sector will collapse and the whole thing will be an utter failure. So I think it's important that we consider that. Now, coming to COVID, before I go into the way forward, I think if you look at COVID, again, government has used this power. It's brought in capping, and capping was done actually without any rationale. Because HPI did a costing at that time. We heard that some hospitals were charging exorbitantly. And to be very frank with you, I cannot afford 10 to 15,000 a day. So we came out with a costing which worked out between 15,000 to about 35,000. And why was it so expensive at that time? Because at that time, only the staff, the team of doctors and staff who were looking after patients worked only for 10 days. 10 days they were in quarantine and then 10 days they were on leave. Also, the PPEs were very expensive. The testing at that time by the government was 9,000 rupees for 2 tests. Now, all that has changed. We're coming out with a new advisory because the PPE cost has come down, the cost of testing has come up. Unfortunately, oxygen price and biomedical waste prices hit the roof. Government doesn't seem to be doing anything there. Unfortunately, it seems to be that the government expects the private sector to take care of these patients, which I don't think is correct. I think they need to be a little more responsible, with apologies to my colleagues from the government who are here. We can have a debate on this later. So coming back again to this issue of pricing and costing. Now, if you want the hospital to be healthy, it is important that the hospital survives. For a hospital to survive, they should be financially viable. For a hospital to be financially viable, they should get at least what they spent. So I think it's the one crucial factor that has to be taken into account by the government, by all the stakeholders. Do a scientific costing. Get stakeholders from outside. In fact, when we did our costing for the government of Karnataka, we got NABH, we got the General Insurance Council, we got the state government, we got NABH. I think something like that needs to be done again, because that is the crux of the issue now. If hospitals are viable, they will grow in number, because if you look at the last 2 to 3 years, there has not been a single investment in hospitals. I know about Bangalore, in the last 6 months, about 80 hospitals have closed down because they have not been able to be financially viable. Now, I think let's keep all that behind. What is the way forward? I think the way forward is, and I would encourage all my stakeholders here, the government has to increase the number of their institutions. They have to use the taxpayers' money. They have to at least come to 70%. They have to make government hospitals accountable. They have to make government hospitals institutions of excellence, which they were till a few years ago. I think this is a major direction in which they have to go. I have to thank the government for the many reforms that we have asked and which the government has acceded to. They've increased the number of medical seats, postgraduate seats. They've increased the number of nurses, because there is also a human resource crunch. In fact, in Karnataka, we have partnered with the government of Karnataka, and we had made about 15 district hospitals training centers for National Board. And that has come in absolutely useful during this COVID time. So I think we are asking our state presidents in various chapters to go to their states, help the state government make their hospitals training centers, because that is the only way that we are going to get specialists. And specialists are a very key factor in giving quality healthcare. The first is that the government has to increase its spending from a measly, pardon me for using that word, a measly 1.2 or 1.5% of the GDP on health. I think the government has to increase it to at least 5%, at least in the next couple of years. Number three, I think it's very crucial that till the government, and even after that, government and the private players, there is some equilibrium. I think we have to work very, very closely together. And I can give you many examples of the way we have done this in Karnataka. We worked with the government and helped them in quality. We've got a couple of hospitals accredited through our license with NABH. I already told you about the national board. We've helped district hospitals become centers of excellence. So I think it's very important. And I think the fourth point going ahead is in the Ayushman Bharat, the most important aspect is the wellness centers. Where I think it's only a futuristic prime minister can think of this. If you are able to focus on wellness, prevent especially non-communicable diseases, ensure that the mothers are looked after well, the children are looked after well, there is healthcare using technology. I think that by itself will prevent at least 30% of the healthcare issues which are happening now. So prevention is far better than the cure. So I think if they focus on the wellness clinics, if they sit with the stakeholders, and if they increase the spending on health, and of course, I don't have to say this, the government has been very fast, especially over the last few months, on using technology. We're absolutely grateful to the government for allowing teleconsultation. Actually, we have been trying to get that done for the last 3 years. It's worked wonders. It will reduce the strain on the health institutions. It will also reduce the cost. So I think these are the few points, and if there are any questions, I'd like to take it. Thank you very much for giving me this opportunity.
Thank you, Dr. Thomas. Thank you so much. Ma'am, just a second. Let me also introduce Mr. Bimblendru Kumar. Mr. Bimblendru Kumar is the Director Personnel of Northern Coalfields Limited. Mr. Kumar and his company, through his chairman, Mr. P.K. Sinha, they have been a source of kind of confidence to us when we have planned to organize something on COVID and CSR relevance. We are also thankful to Mr. Kumar. We are just now listening to Dr. Alexander Thomas. He is the president of the Association of Healthcare Providers of the country. And the points that he raised, I think with you joining from the public sector corporate perspective, the way recently you donated 5 crores to the Uttar Pradesh Chief Minister's Fund for ambulances. Mr. Kumar, we cannot see your face properly. Thoda sa camera. Haan. Dr. Thomas, Madam Stuti Kakkar is also there. She was Secretary to the Government of India. Madam was Secretary. She set up the Disability Department, the Divyangjan Department of the country, along with Thawarchand Gehlot Sahab. And Madam is also instrument. I mean, if I'm not wrong, and also she was the chairperson of the NCPCR, the Children Commission. Now, Mr. Kumar and his company have been supporting these initiatives recently. And you, from the medical perspective of Thomas, have thrown a lot of light about how public and the government, public companies and the government can help in establishing a public-private partnership. So since you represent the private healthcare providers and they represent the public sector and a corporate, I think this is going to be wonderful to now listen from Mr. Kumar about what are the initiatives they faced, they have done, what are the challenges they have faced, and how they can look forward to associating with healthcare providers like your association, which has got so many companies, big and small, with whom they can collaborate across the country and make this public-private initiative to tackle COVID pandemic a little bit easier, because here we have the public money and you have the healthcare providers together with us. I'll leave it to Stuti Kakkar. She was going to tell us something before Mr. Kumar takes up.
Okay. Actually, Dr. Thomas, I wanted to thank you. Today, I'm associated with a private hospital called the Subharti Hospital in Meerut. And initially, when COVID started, the cases were just sent to us. You deal with them how best you want. Not even PP kits or other things were supplied. And the poor doctors, nurses, and everybody They had to wear their operation theatre gowns and treat these people. In fact, my nephew, who was at the forefront, has treated about 1,600 patients now. He got COVID also. So I had to actually intervene and ask the district magistrate, why on earth are you not supplying them with PPE kits when government has given it? Because there is no recognition of the private initiative. So you're taking it up in a big way with the government will help a lot of these smaller hospitals who don't have that kind of profile which Dr. Devi Shetty has. But everybody needs a champion. And it is very essential that government recognizes the efforts of the private sector instead of just, they have to understand things like the private sector is not funded with the taxpayers' money. And therefore, survivability of it is an important issue. And therefore, this has to be made very clear with doyens like you that as they look into the sustainability of these hospitals, they cannot sustain themselves. And then we have to respect the capabilities and capacities of the medical staff. They are not robots. They're human beings like us. They have the same burnout. They have the same kind of problems. And therefore, all these things have to be brought out. Initially also, COVID is a medical problem. It was made into a humanitarian problem, but actually it was a medical issue, and we should have tackled it like a medical issue, seen to the wherewithal. It's no difference. There is no difference in handling COVID to handling a flood. You just had to get all your resources and be clear here about how to tackle. Anyway, I'm looking forward to Mr. Bimlendu Kumar now.
First of all,
Have great respect.
I'm very sorry for joining you late. I was busy in some meetings. Just now, I became free, so I came here. This is Rajbhasha Mah, September, Rajbhasha Akhwara. So, with due permission of Chair, I shall like to, whatever I shall speak to a few lines in Hindi, Rajbhasha. मैडम, हम लोग अभी यहाँ सिंगरौली बहुत छोटी जगह है, आप ऑलरेडी यूपी की है, सोनभद्र के बगल में है, हाल ही में यह जिला बना है। यहाँ हम लोगों को फ्लाइट पकड़ने के लिए भी 250 किलोमीटर बनारस जाना पड़ता है।
तो है
सड़कें अभी उतनी अच्छी नहीं है। मैं सिर्फ यही कहना चाहता हूँ, यह मोर और लेस हम लोग जंगल में रह रहे हैं, यहाँ उतनी अच्छी सुविधा नहीं है जहाँ बड़े शहरों में होती है। यहाँ का हॉस्पिटल सबसे बड़ा हॉस्पिटल हमारा ही है, सबसे बड़ा हॉस्पिटल हमारा ही है एनसीएल का, जो नेहरू जी के नाम पर है, नेहरू चिकित्सालय। स्टेट गवर्नमेंट के हॉस्पिटल में 60 बेड ही है। मैं यह कहना चाहता हूँ कि मोरल रिस्पॉन्सिबिलिटी इस इलाके की हमारे ही पास है, पूरे इस इलाके की। एनटीपीसी के बहुत सारे यहाँ पर है सत्य, और उनके भी हॉस्पिटल बहुत बड़े नहीं है। जब कोविड शुरू हुआ था, शुरू में उस समय पैनिक आज भी है, जबकि केसेज आज बहुत अधिक हैं, उस समय पैनिक अधिक लोग डरे हुए थे। मास्क नहीं थे मार्केट में, सैनिटाइजर नहीं था, पीपी किट नहीं थे, बट सरकार ने सारी चीज मुहैया कराया। हम लोगों ने उस समय करीब आज के दिन तक करीब 1.5 से 2 लाख मास्क हम लोगों ने यहाँ के लोगों को बांटे हैं, बाहरी लोगों को, अपनी कंपनी के अलावे। हम लोग का छोटा परिवार है कंपनी का, करीब 14-15 हज़ार हम लोग अपने पे, 14,000 एम्प्लॉय अपने हैं, 15,000 करीब कॉन्ट्रेक्चुअल हैं, सब मिला के 30,000 हुए हम लोग काम करने वाले, और उसका ले लीजिए 1,20,000 परिवार होंगे सब। और उसके अलावा करीब हम लोगों ने 1.5 लाख के आसपास, एक समय ऐसा था कि घर हम लोग निकलते थे, सारे लोगों के मास्क पर एनसीएल लिखा रहता था। सिमिलरली सैनिटाइजर मोर देन 1 लाख लीटर हम लोगों ने बांटे यहाँ पर है। हैंड वॉश के लिए हर एक जगह व्यवस्था हम लोगों ने की है। पहले तो हैंड वॉश टेप से हुआ करता था, अब हम लोगों ने शुरू किया है कि अब बिना हैंड टच किए हुए अगर हैंड वॉशिंग हो जाए तो बेहतर है। शुरू के समय आपको याद होगा पीपी किट की भी बहुत कमियां थी, बट पीपी किट अब प्रचुर मात्रा में अवेलेबल है। ये तो हुआ उन्होंने गांव वालों ने किया, आसपास लोगों ने किया, पर हमारे अपने एम्प्लॉई है। कोयला का प्रोडक्शन बंद नहीं होना चाहिए। कोयला प्रोडक्शन बंद तो बिजली बंद, बिजली बंद तो सारा चीज बंद। हम लोगों ने साथ में अपना काम भी उसी रूप में चालू रखा है। जितना हमारा टारगेट था हम लोगों ने करीब करीब प्रोडक्शन उतना ही किया है। उसको करने के लिए व्यवस्था चाहिए। तो हम लोगों ने पहली कंपनी है ना शुरू किया कि जितने केबिन है हमारे ऑपरेटर्स केबिन है, हर एक शिफ्ट में वो सैनिटाइज हो। जहां जहां हमारे ऑपरेटर टच करते हैं, जहां पॉसिबिलिटी है, हैंडल है उसके, एवरीवेयर स्विच है, हम लोगों ने हर एक शिफ्ट में शुरू में और बाद में सैनिटाइज करना हम लोगों ने शुरू किया। हमारे एम्प्लॉय दूर में रहते हैं माइंस के, वहां कैसे बस से आते थे। स्टेट गवर्नमेंट भी यहाँ काफी कोऑपरेटिव हम लोग का है, तो उन्होंने अलाउ किया यू कैन यूज स्कूल बसेज ऑल्सो। हम लोगों ने स्कूल बसेज को भी अपने एम्प्लॉय को शिफ्ट, स्कूल सारे बंद हो गए हैं, स्कूल बसेज को अपने एम्प्लॉय को शिफ्ट करने में लगाया और एक सीट पर एक बस बैठाने की व्यवस्था उन्होंने की। बायोमेट्रिक अटेंडेंस की व्यवस्था थी, उससे हम लोग डिस्पेंस किया। कॉलोनी के सेट हम लोग यहाँ एक मशीन है, बड़ी मशीन है जिसे डस्ट सप्रेस करते हैं, उसको हम लोगों ने यूटिलाइज किया कॉलोनी सैनिटाइज करने के लिए। हमारे यहाँ CI है, उनकी कोई व्यवस्था है, उन लोगों ने काफी हेल्प किया। अब आई हॉस्पिटल की, हॉस्पिटल यहाँ थी नहीं, स्टेट गवर्नमेंट ने हमसे रिक्वेस्ट किया कि आप करें। हमारे पास 150 बेड की है, करीब करीब 250 बेड, 250 लोग उसमें एकोमोडेट कर लेते हैं। 50 बेड हम लोगों ने अलग से कोविड वार्ड बनाया, रास्ता नहीं था, दीवार तोड़ के हम लोगों ने रास्ता बनाया उन लोगों के लिए, अलग से व्यवस्था लिफ्ट की, ताकि 50 बेड जो कंफर्म पॉजिटिव केसेस है वो भी कम पड़ने लगे। स्टेट गवर्नमेंट के 60 बेड, हमारे 50 बेड। तब कल्याण मंडप हम लोग के यहाँ है, शादी की व्यवस्था के वेलफेयर में कल्याण मंडप है। कल्याण मंडप में भी हम लोगों ने 100 बेड की व्यवस्था की और उस 100 बेड को स्टेट गवर्नमेंट ने अपने कंट्रोल में लिया। 50 बेड हमारे पास में है, इस तरह 150 बेड हुए। उसके अलावा 100 बेड और एक दूसरे कल्याण मंडप में व्यवस्था हम लोगों ने की उसके लिए, क्वारंटाइन के लिए। इस तरह 250 बेड की व्यवस्था हम लोगों ने किया है जो ऑफिशियल है। उसके अलावा भी बहुत सारे हैं, कुछ क्वार्टर्स खाली करा के हम लोग किए। धीरे धीरे आप देख रहे हैं कि जहाँ कुछ 0 केस थे हमारे यहाँ, अब बहुत सारे केस आ गए हैं। हमारे एम्प्लॉय आज के दिन में, आज सवेरे मालूम हुआ मेरा ड्राइवर पॉजिटिव हो गया, मेरा खुद ड्राइवर, इसलिए आज से मैं क्वारंटाइन हूँ। मैं अभी घर से मैं बात कर रहा हूँ, अपने ऑफिशियल जो रेजिडेंस का ऑफिस से बात कर रहा हूँ। इसी तरह हमारे एक 2 डायरेक्टर टेक्निकल है, दोनों डायरेक्टर टेक्निकल कोई पॉजिटिव हो गए। ड्राइवर तो हुआ ही, खुद पॉजिटिव हो गया। तो काफी हम लोग इतने प्रिकॉशंस के बाद भी स्टेट गवर्नमेंट ने काफी प्रिकॉशन लिया। अब इस तरह से क्योंकि प्रवासी लोग आने लगे, प्रवासी है, फिर बच्चों का एग्जाम होने लगा, बच्चे एग्जाम से बाहर जाने आने लगे, स्कूल कॉलेज बाहर के बंद हुए। हो सकता है उस कारण से, क्या कारण है अब कहना मुश्किल है। पहले कुछ हजार में थे, अब देख रहे हैं कि भारतवर्ष में 40-45 लाख हो गए। तो फिर भी हम लोग उसमें समहाउ जितना हमारे हम लोग कर सकते हैं हम कर रहे हैं। जैसा कि अभी अमित जी ने कहा, एम्बुलेंस के लिए हम लोग एक रिक्वायरमेंट आया था स्टेट गवर्नमेंट से 10 करोड़ का 100 एम्बुलेंस के लिए। तो हम लोग ने, बोर्ड ने पहले 5 करोड़ दिया है। परसों ही 3 दिन पहले मैं खुद गया था, CM साहब खुद पर्सनली देके आया हूँ मैं और मेरे CMD साहब। 5 करोड़ रुपया, 5 करोड़ और एश्योर किया हम लोगों ने, इसे खरीदे, फिर सेकेंड फेज में दूंगा। उसके पहले जब शुरू ही हुआ था तो एक रिक्वायरमेंट, क्योंकि मेरा 80% कोयला होता है मध्य प्रदेश से, 20% होता है यूपी से। मध्य प्रदेश के चीफ सेक्रेटरी ने रिक्वेस्ट किया था कि CM फंड में दें। हम लोग ने उसमें 20 करोड़ रुपए इमीडिएटली एक दिन के अंतराल में 24 आवर्स में 20 करोड़ रुपए हम लोगों ने उनके अकाउंट में भेज दिया था, 20 करोड़ रुपए। उसके अलावा जो डिस्ट्रिक्ट है यहाँ आसपास, सोनभद्र डिस्ट्रिक्ट है, सिंगल डिस्ट्रिक्ट है, इसमें करीब करीब 4.5 करोड़ रुपए का हम लोगों ने सामान, डिफरेंट मास्क है, सैनिटाइजर, हैंड वॉशिंग मशीन, हैंड वॉशिंग PPE किट, उसके अलावा उनके हॉस्पिटल है, हॉस्पिटल को इक्विप करने का 4.5 करोड़ का सामान अलग से। उसके अलावा और भी जो गांव में जो भूखे हैं, जो शुरू में जो इस तरह का प्रॉब्लम हुआ, तो खाने का प्रश्न था, तो करीब करीब मुझे याद नहीं है 3 से 4 हजार करीब हम लोगों ने 15-16 किलो खाने का पैकेट बना के बोरी बनवा करके करीब 2,500-3,000 के ऊपर पे हम लोगों ने बांटा है स्टेट गवर्नमेंट के साथ रह करके उनके स्वजन से उनके ऐसा हम लोगों ने दिया पैकेट बनाया हम लोगों ने उन लोगों ने हेल्प किया कहाँ से देना है मोर देन 3,000 अभी आपने देखा होगा कि प्रवासी लोग आ रहे थे ट्रेन में भूखे थे जितने हमारे एरिया में स्टेशन आते हैं रेणुकूट है या सिंगरौली है नॉट ओनली दैट इवन बनारस 250 किलोमीटर है मुगलसराय वहां भी हम लोगों ने यहाँ टीम से भेजा वहां स्टेशन पर ट्रेन में प्रवासियों को हम लोगों ने खाना सप्लाई किया यह थोड़ा सा है जितना मुझे याद है मेमोरी में क्योंकि मैं खुद क्वारंटाइन में घर में हूँ मेरे पास पेपर कुछ नहीं है जितना मेरी मेमोरी में था वो मैंने आपको किया बट यही बंद नहीं है हम लोग भी ओपन है स्टेट गवर्नमेंट से जो भी हेल्प जो मांगा जाता है जिस समय भी दोनों डिस्ट्रिक्ट के डीएम जब भी आते हैं वट एवर दे आस्क टू प्रोवाइड देम और बट अभी थोड़ी सी परेशानी क्या हुई है कि लोगों में जागरूकता जितनी शुरू में थी अधिक होनी चाहिए थी कम हो गई है और लोग थोड़ा हैबिचुएटेड हो गए हैं या जैसे भी हो तो अभी हम लोग एक और मुहिम हम लोग चलाया है कि ऑटो से 3 व्हीलर से हर एक गांव में मोहल्ले में कॉलोनी में जागरूक करने के लिए बैनर लगा करके ये अभी ऐसा नहीं है कि कोविड खत्म हो गया अगर अभी चरम सीमा पर है आप प्रिकॉशन लें इसका हो सकता है कुछ लोग काम करते करते आदत हो जाती है लोग उससे उब जाते हैं कुछ उब गए होंगे मे भी उसको ये हम लोग ने अभी करीब 5-10 दिन पहले शुरू किया है हर एक गाँव में मोहल्ले में हमारे कॉलोनी में जाकर के उनको एजुकेट करना कि आप क्या क्या करें इसके लिए तो इसको कर रहे हैं इसमें हमें स्टेट गवर्नमेंट के साथ मिल रहा है हमारे एम्प्लॉय भी हैं हमारे कुछ एम्प्लॉय ऐसे हैं जो अपनी तरफ से कर रहे हैं इसके बावजूद भी कुछ कैजुअलिटी हुई है हमारे 3 एम्प्लॉय उसमें एक ऑफिसर भी थे उनका देहांत हो गया उसके दूसरा कारण पॉसिबिलिटी है कुछ लोग को छुपाने की आदत हो गई थी कि कोविड कहने पर भी शुरू में सिम्टम आने पर भी बोलते नहीं थे वो हम लोग घर घर जाके प्रचार करें नहीं आप या कोविड जब हमारे गृह मंत्री को हो सकता है किसी देश के प्रधानमंत्री को हो सकता है तो हमें आप क्यों नहीं होगा आप आगे आए हम आपके इलाज के लिए तत्पर हैं और जो भी सुविधा होगी हम आपको देंगे उसका कुछ प्रभाव पड़ रहा है लोग आगे आ रहे हैं और लेट्स सी तो लोग क्या कर सकते हैं और किसी भी इस मुहिम में एनसीएल हमेशा अग्रसर रहा है एनसीएल इन पर्टिकुलर एंड कोल इंडिया एज ए होल हम लोगों ने करीब पीएम फंड में हमारे कोल इंडिया ने जिसका मैं जिसके सब्सिडी में काम करता हूँ मोर देन 250 करोड़ रुपए पीएम फंड में हम लोग दिया हम लोगों ने अपने एक दिन की सैलरी पूरे कोल इंडिया की एम्प्लॉय ने एक साथ करके पीएम फंड में दिया हम लोग सभी तरफ से आगे हैं कर रहे हैं दोनों साथ में कर रहे हैं काम भी हमारे काम भी बंद नहीं हुआ प्रोडक्शन चल रहा है 100% जितना बड़ा टारगेट हमारा है उतना हम कर रहे हैं साथ में सामाजिक काम भी लोगों को एजुकेट करने के भी वो काम कर रहा है धन्यवाद थैंक यू
So it was, I think, huge amount of work that has been enumerated by Northern Coalfields as one of the public sector companies. I'm not sure whether Dr. Alexander Thomas could comprehend Hindi completely.
Yes, I could.
Dr. Thomas, was it possible?
Yes.
So you are conversant with Hindi?
Yes, I understood. Yes, I'm not,
So now-
grammar is not very good, so I don't dare to speak,
But you could understand. Because this conversation, I think, was very important because
Yes.
now we know how much public sector companies are working towards tackling pandemic like this, and how association like yours with hundreds of top healthcare providers of the country, small, big, all kinds of, can collaborate with such public sector companies in their plant affected areas. And those places you could probably work together and create a more effective kind of a solution to this tackling of this COVID pandemic. I think we have had a very enriching panel. Sutiji, I think, is off camera. Sir, I think you need to say something. Dr.
Yeah.
Thomas?
So I was just, yes, I think a wonderful and huge amount of work which Sri Vimlendu Kumar is doing. I just wanted to ask, do you have any training programs? So there is a saying in English that don't give fish, teach them how to fish. So by training doctors, I'm sure you're eligible for a training nurses, training paramedics, you'll contribute to the
Yes, sir. Yes, sir. We have trained all the doctors. One nodal officer is there. He is from AIMS. And first he was trained by state government. Then he had trained all the doctors. All the doctors are paramedical.
No, sir. I'm talking about formal courses, sir, to create specialists. Now that National Board has come up with these diploma courses, the National Board, College of Nursing, School of Nursing, Allied Health. So they can train with you. You've got a fantastic hospital. You've got huge resources. And you will be helping the health of the country by getting these people trained and sending them out into the community.
Sir, there are two nursing colleges here, Jigoli. We are providing our facility for their training. Their experts come to our hospital and they take training, sir.
So my suggestion to you, sir, is why don't you start your own training of nurses and doctors, and we'll help you with that, sir. We can help you with that if you.
So we are there, but it is a very small place. We had assessed that it was in our program, already approved program. But when we found out that there are two nursing colleges are nearby, hardly 5 kilometers radius, then it was not possible to get a student for that. So we have dropped that. We have already approved from there with that.
Thank you so much, all the dignitaries. It has been a wonderful session with all of you, and the thoughts that you have put in, the inputs that you have put in, and the plans that you have suggested for the government and everybody has been remarkable. And I think this is going to be a very enriching kind of an experience for whoever watches this video. And we are definitely on a good track in fighting this pandemic, and we hope we all will sail through very soon. Thank you so much for joining us.